Continuing with the types of synovial joints, we have condylar joints, like the ones that are between the radius and the ulna and scaphoid bones. So we call this the radiocarpal joints, but also the metacarpophalangeal joints 2 through 5, and the metatarsophalangeal joints. Saddle joints, like the first carpometacarpal joints, shown in this picture. And then the well-known joint, ball and socket joint, like at your shoulder or your hip joint. These are all types of synovial joints. Let's talk about the different types of movements that we will commonly use, and we'll use these a lot when we talk about the muscles. Flexion and extension. This refers to the movements at the hinge joint of the long bone of the limbs. So flexion decreases the angle of the joint. And a common flexion is like with your forearm, or when you're trying to basically show your muscle in your upper arm. Whenever you move your forearm to reveal the muscle, you're decreasing the angle, so that's flexion. Or if you extend your forearm out, that is extension. The same thing is true if you are raising your lower leg behind you. You are decreasing the angle between the femur and the tibia. So that would be a flexion, but if you extend it outward, that is extension. They also show you here if you are moving your entire leg forward, that is flexion because you're decreasing this angle between your body and your whole leg. And when you're moving it the other way, that is extension. There's also such a thing as hyperextension when you go beyond the straight. You can do the same thing with your head. Moving your head forward is called flexion because you reduce the angle. Moving your head back is extension, or all the way back is hyperextension. Again, what this is showing you is flexion and now extension. Flexion, extension. Flexion, extension. There's also such thing as lateral flexion, like bending the vertebral column to the sides. This is most pronounced in the cervical and thoracic region. Again, you are decreasing the angle between the body and the skull or the neck area. There's also special terms for movement of the feet. Dorsiflexion is upward movement of the foot or toes. Plantar flexion is movement extending the ankle as in standing on your tiptoe. So dorsiflexion, moving your foot up. Plantar flexion, moving your foot down. Again, looking at this picture, dorsiflexion, plantar flexion. Abduction and adduction. This is the movement of the appendicular skeleton. Abduction is moving away from the longitudinal axis in the frontal plane. So as you can see, moving your entire arm away from your body is abduction, but moving it back towards your body is adduction. Same thing with the leg. Moving the whole leg away is abduction, moving it back towards the middle, medial, adduction. You may want to think about this as if you move your arm towards your body or leg towards your body, you are adding it back to your body. We can also talk about adduction and abduction with the fingers. So moving them together is adduction, away is abduction. You can also move your entire hand laterally at the wrist. Okay, adduction is towards medial, towards your body, abduction away from your body. Okay, that's abduction, adduction. Circumduction, moving a body part such that the distal end traces a circle while the proximal end stays in one position. So moving your entire upper arm in a circle. Let's look at specific terms describing rotation and special movements. For rotation, when you refer to the trunk, described as left and right rotation, described in reference to the anatomical position. So for example, moving your head to the right and left, that's right rotation, left rotation. That occurs at the atlantoaxial joint. When you move your arm in and out, you have a lateral external rotation and a medial internal rotation. So you're basically moving your arm at the joint of your where your deltoid is. When referring to the limbs, this is described as medial rotation, internal or inward rotation. This is the same thing I was just talking about. The anterior surface of the limbs turn towards the long axis of the trunk. So keep in mind again where you're actually turning the arm is up here at your shoulder. Special terms for the rotation of the forearm. Movement occurs at the proximal joint between the radius and ulna. The radial head rotates. So in this case, it's showing pronation. This is the distal epiphysis of the radius rolls across the anterior surface of the ulna. And this turns the wrists and hands from the palm facing front to the palm facing the back. So you're only moving the forearm. Palm facing front to palm facing back. That's pronation. Supination is the opposite. Palm is turned anteriorly from the back to the front. Other special movements, opposition. This is movement of the thumb towards the surface of the palm or pads of other fingers. This enables grasping objects. You've heard of opposable thumbs. It's one of the things that we have that the primates do not. When we're talking about the foot, we can move basically the plantar part of the foot towards the inside or medial. That is inversion. Oppositely, eversion. When you move your entire skull to the front, we call that protraction. So moving it anteriorly in the horizontal plane, moving it back is retraction. Depression and elevation, like your mandible. Depression is moving the body part inferiorly, so opening your jaw. Elevation is moving the body part superiorly or closing your jaw. Okay, axial joints. These are very strong joints. They permit very little movement. Examples like the atlanto-occipital joint, that's the articulation between the occipital bone and your atlas, or the atlantoaxial joint, the articulation between C1 and C2. Okay, other joints of the appendicular skeleton. We have an extensive range of motion here. They're often weaker, though, than the axial skeleton. So you see several listed along here. Here's some examples like the sternoclavicular joint, the articulation between the axial skeleton, the pectoral girdle, and upper limb. Or the sacroiliac joint, attaching the sacrum of the axial skeleton to the pelvic girdle. These are not quite as movable. Okay, the vertebral column includes three types of joints. Syndesmosis of the vertebral column, like the fibrous joints, including the vertebral ligaments. Then you have synchondroses of the vertebral column, the intervertebral joints forming the intervertebral discs. These account for a quarter of the length of the vertebral column. As you age, the water content decreases. You have loss of cushioning ability, which increases your risk of vertebral injury. And your vertebral column shortens, so you actually get shorter as you get older. You also have vertebral synovial joints, the joints between the bony processes. If we look at the intervertebral disc components, you have an annulus fibrosus. This is the tough outer ring of the fibrocartilage. Collagen fibers attached to the adjacent vertebrae. And on the inside, you have the nucleus pulposus, the soft, elastic, gelatinous core. This gives resilience to the disc and also allows it to be a shock absorber. The primary vertebral ligaments include the ligamentum flavum and the posterior longitudinal ligaments. I'm not requiring you to memorize these. There are lots of ligaments around the vertebrae. And the interspinous ligament. As you can imagine, we need a lot of support in the vertebrae. Supraspinous ligament. The anterior longitudinal ligament. Now, the intervertebral disc can have problems. You can have intervertebral disc disease, like bulging discs, caused by weakened posterior longitudinal ligaments. This allows compression of the nucleus pulposus, distortion of the annulus fibrosus. The tough outer layer of the cartilage bulges laterally, as you can see in these pictures. You can have herniated discs. The nucleus pulposus breaks through the annulus fibrosus, protrudes into the vertebral canal. This compresses the spinal nerves, so it can be quite serious. Osteopenia. This is inadequate ossification that leads to loss of bone mass. Usually occurs with age beginning between age 30 and 40, and tends to be more severe in women than men. This can lead to full osteoporosis, where you have bone loss. Loss of bone mass occurs along with reduced cushioning of your intervertebral discs. This increases incidence of vertebral fractures. If we look at some specific joints, the shoulder joint or glenohumeral joint is the greatest range of motion of any of the joints and also is the most frequently dislocated. This shows how the stability is sacrificed for mobility. It is a ball and socket diarthrosis, the articulations between the head of the humerus and the glenoid cavity of the scapula. It's stabilized by 5 major ligaments that surround the muscles and associated tendons. The bursae here help reduce friction. The tendon of the biceps brachii surrounded by tubular bursa as it passes through the articular capsule. So you can often have bursitis here. Cause a lot of pain and limit your movement. The glenohumeral joint is stabilized by ligaments. Several listed here. Again, you do not have to memorize all of these. The glenohumeral joint features articular capsules that helps with extensive range of motion. You have a small articular cartilage and a glenoid labrum, the fibrocartilage rim, and this increases the area of the glenoid cavity.